Hi everyone, it's me Roslyn and I wanted to share my experience regarding birth control. So I got pregnant and gave birth to our baby Daenerys last August 19, 2017 and we are planning to have a child after 2 years. So we need to have a birth control. And a while ago, we went to the hospital and the doctors explained to me the different kinds of birth control method. And they have this method, like these 5 methods that really works well, like 99.99%, and it's only 1 woman out of 100 who got pregnant of this birth control method. So these are the implant for 3 years, the IUD Skyla for 3 years, the IUD Mirena for 5 years, the IUD Paragard for 12 years, and they have the forever that you will not get pregnant, the sterilization for men and women. So that method is the 99.9% effective that you will not get pregnant. And then the next one, the 50% that you will get pregnant, or it's kind of okay or so-so. The pills that you will take every single day, the patch that you will take every week, the ring for every month, and the shot for every 3 months. So this will works like out of 100 women, 6 to 10 women who got pregnant on this method. Okay? And the next one is the not so well, not sure. So the withdrawal, the diaphragm, the fertility awareness, and the condoms. So out of 100 women, there is a 12 to 24 women who got pregnant on this method. So out of that method, my choices is either the implant or the IUD Mirena. And I do search, of course, because I wanted to know first before I will decide which method that I will get. So my other friends told me that the implant is good, and the other friends told me that the IUD is good. But my concern on IUD, because they will insert it inside your vagina, so I'm worried if I will feel uncomfortable because there's something inside of my vagina. And they said, because it's like a T, this one, I don't know if you can see it. So it's looks like that. It's T. So some says if this part, the letter T, breaks down, you will get pregnant. And the thing is, if that T breaks, so it's still in your vagina. So I don't know how it feels. I really don't know. So that is my concern on IUD. And my concern on implant, because since it's implant on your arm, you can feel that. So I don't know if I will feel comfortable again because I can feel that implant. So upon explaining further of my doctor, she said that of course you will feel your implant. And on IUD and implant, most of her patients choose the implant. And also, if you choose the implant, it will last the bleeding, the cramps. Because if you choose the IUD, you will have more bleedings, cramps. Actually, it depends on the IUD you will use. If sometimes the other IUD makes you bleeds more, the other IUD will not make you bleed. Like you will become irregular. If you are regular, you have a monthly period, you will have irregularity of your menstruation. So since I am irregular, it's fine with me if I will not have my monthly period. So that's okay. So upon explaining and upon asking Marcus regarding that, so I choose the implant because I am really more worried on IUD because they will insert it on your vagina. I think that is more painful. At the same time, I don't know if I will feel comfortable in that. So I decided to use the implant. Okay, so the implant is named like etonogestrel. A subdermal implant is a contraceptive or birth control method. It is used to prevent pregnancy. It is a FDA approved for 3 years of use. The studies show that it has continued effectiveness through the 4th year of use. You can have it removed at any time. So the common brand name of the implant is Implanon and Nexplanon. And then how this birth control work. The hormone in the implant is absorbed by the body and prevents the body from releasing an egg from the ovary or ovulating. This hormone is a synthetic progesterone and is safe with breastfeeding because I do breastfeeding at the same time formula. So I need the birth control method that is safe for breastfeeding. Okay, but before you will decide which method you want for birth control, you need to inform the doctor if you have any of this condition like abnormal vaginal bleeding, cancer of the breast, heart disease or recent heart attack, liver disease, stroke, lupus, or if you are pregnant, or unusual or allergic reaction to etonogestrel, other hormones, anesthetic, or antiseptics. Okay, the contraceptive implant is one of the most effective methods available, but no birth control is 100% effective. If you have symptoms of pregnancy, take a pregnancy test or come to the clinic to be evaluated. Okay, and then how this medicine works, or how should I use this medicine. This device is inserted just under the skin on the inner side of your upper arm by the healthcare provider. Once it is in place, it provides long-acting contraception. So this is it. So this is where the doctor insert the implant, the etonogestrel. Okay, the process is first, because I am a C-section, they check my heartbeat, they check my breast, they check my insertion, they check my vagina if it's bleeding or there's something wrong on it. So after checking and everything is good, they inject here a anesthesia, so I will feel numb and I will not feel the insertion of the implant. And then after 15 minutes they insert the implant. So that's it. It took me like 20 minutes for the anesthesia, start of the anesthesia to inject the implant. So 20 minutes. It's really fast. And then after that, the doctor told me to hold it and then to touch it. And then when I touch it, so I can really feel it. Yes. So the doctor told me, if you will touch it, of course you will feel it's there. But if you ignore it, that it's something inserted in your arm, so it was fine. And the doctor told me that I can do whatever I want, like you can do lifting, playing badminton, carrying heavy things. You can do. There is no restriction on this implant. Okay? And then after that, what should I watch for while using this medicine? You may feel some soreness in your arm for a day or two after the implant is placed. You should keep a small bandage over the insertion site for 3 to 5 days. This one. You may take over-the-counter pain relievers to help with the soreness. If you have heavy bleeding, which is bleeding that fills a pad or more an hour, strong pain, which is pain not helped by over-the-counter medicine, or redness, or swelling at the insertion site, you need to call the family planning nurse and inform them what's happening to you, what's happening to that insertion, okay? That implant rather. And then you should be able to feel the implant by pressing your fingertips over the skin where it was inserted. So you can feel it. It was here. And I can feel itchy. It's so itchy. I don't know if it is because of this bandage or it's because of the implant. So I will make a video follow up of these videos, and I will tell you how does it feel, is there any side effects on me, and so that you will have an idea on this kind of method, the implant. And then so the nurse told me that though I have an implant, we cannot do sex without condoms because there is a chance that I will get pregnant. So I need to wait a week after we have sex without condoms. And the nurse gave me this. Da, 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 da. Lots of condoms. This is 20 pieces. And also how to use condoms. So the nurse gave me this because so that if we will have sex now or the next, like second day, third day, fourth day, until fifth day, we need to use this. And that's it. So I will make another video follow up on this video how I feel about the implant. And if you have any questions, clarifications, just feel free to comment on my video. And I hope this video help you or give you an idea if you are pregnant. If you want to have a birth control, what method you will use. I hope this video will give you an idea if you wanted an implant. Okay, so if you are not yet subscribed to my YouTube channel, please do subscribe on my YouTube channel for more videos. So that's it, guys. Thank you very much. Have a great day. Bye bye.